Go to a grocery store or shopping center in San Diego, La Mesa, or Chula Vista, and you might see people collecting signatures for a couple ballot initiatives. One seeks to limit healthcare executive compensation, and the other would implement a $25 per hour minimum pay.
That is the baseline to be able to make it in California.
Renee Saldana is a spokesperson for the union behind the ballot initiatives. She says the pandemic made staffing shortages worse, and some are leaving for higher paying jobs in retail or food service.
So we were hearing that many healthcare workers just can't afford to live where they work in San Diego. They are working 2 or 3 jobs, just really struggling to make ends meet.
This would impact positions including receptionists, cleaning staff, maintenance workers, and security guards, not nurses or doctors. But Saldana says it would also boost pay for some who provide direct care.
Certified nursing assistants, patient care technicians, dialysis technicians. These are many of the folks who are at the lower end of the wage scale in healthcare. And these are also folks who have some of the most contact with patients.
SEIU UHW is behind a similar legislative push. They're supporting a Senate bill that would also boost healthcare jobs to $25 an hour. Most hospitals we reached out to referred us to the Hospital Association of San Diego and Imperial Counties. They're opposed to both initiatives. CEO Dimitrios Alexio says health providers support fair and living wages, but
passing measures city by city, including some workers while excluding others, just simply isn't good policy. It's something that we definitely support our healthcare workers, but from a financial perspective, you're talking about increased expenses and costs to the bottom line without additional revenue, which puts hospitals and other providers in a tough position.
Alexio referred to them as operational handcuffs should the initiatives make the ballot and pass.
Providers will have to make difficult decisions, and some of that could be, access. Unfortunately, some of that could also be, facilities end up closing. We've seen some of that already throughout the state without minimum wage conversations.
Alexio says some hospitals operate on thin margins, but SEIU UHW pushes back against the notion that health systems can't afford this.
What they can't afford to do is lose more healthcare workers in our system.
If enough signatures are collected and verified, voters in San Diego, La Mesa, and Chula Vista would see the initiatives on the November 2024 ballot. Matt Hoffman, KPBS News.